we go. Thursday, July 8th, 1976. Rural health doctors arrive in Only. Back in those days, it wasn't even called Eastern Shore Rural Health yet. It was Accomack Rural Health. And we were news. We were big news. The impetus to recruit us came from the health department, Dr. Belle Fears, who was legendary.
I was in private practice. I worked 7 days a week, day and night, and was on call all the time. They just got so I couldn't handle it, so I quit and went to work for the health department. And all the time I was trying to recruit a doctor to replace me. I got a committee together, and they were the heads of health agencies in the area.
Bob Parks was the president of the board. He was just a leader. He did everything in this community. So he owned Parks Market. He described himself as a grocer. And he owned a hardware store on Chincoteague. He was on the board of the bank. He was on the board of the hospital. He was head of the fire company, an EMT. So Bob was just involved with anything, and he just had this vision that he was going to bring modern healthcare to the shore, and he was going to do it through Eastern Shore Rural Health.
He and Dr. Belle Fears, who actually was the health department director, had been both a participant on a board that realized that we needed more doctors in northern Accomack County, let alone the Eastern Shore. And so when this idea of a 330 grant or some sort of grant would be given to communities that, would go without, either because of insurance issues or not enough doctors, they went up to Philadelphia when that was with the Region 3 office. They went in and spoke to folks and were turned down. I said, we don't see how we can fund this program. They went out literally in the hallway, and picture an old Philadelphia building with wooden benches in the hallway, and they sat down and they decided they needed to go tell the story even more colorfully and more clearly. And they did just that. That's how we got the first grant of $100,000 to get started in Eastern Shore Rural Health in 1976.
We were camped in the Rudiger building over in Only, which had 4 examining rooms, a little laboratory with a microscope, and a front desk and a reception area, and that was pretty much it. We started out 2 doctors, 2 nurses, and 2 administrative assistants. And this is the guy who was the executive director. His name is John Bunting. He was a retired Navy captain.
There were challenges back in those days of finding the right person who was very focused on the mission. And so Carol Reinerth, who actually worked as the secretary, decided that she would go ahead and apply for the job. And it was quite an escapade because no women would be hired for that job, frankly. And so she fought for that job. She had been doing the job all along in many, many ways. And so it took quite a lot of convincing. But indeed, she ended up being selected as the executive director and was that for nearly 20 years.
She was able to prove that there was just no stopping her. So we were very fortunate to have someone with her vision, at the beginning of the organization.
She was very mission driven, always reaching out to the community. That's why we have our centers up and down our peninsula here, because she wanted it to be easily accessible to all of her patients. And that was Carol's passion, was to keep growing. Now we have 40-some thousand people that live here on the Eastern Shore, and she would want them all to be our patients.
She really did put this organization on the map. She put it together. Her goal was to make sure that no matter what, she would be sure there would be access to care, all the way down from Cape Charles, further down to Kiptopeke and Townsend, all the way up to the Maryland state line. And she did just that. I came to Eastern Shore Rural Health in 1983. My background is health education, and that's how I got my start. I was a part-time health educator and conducted patient education as well as community events here on the shore. As far as on the medical side, we had 1 medical center. So from there, the real focus was up north at the Atlantic Center. That's where the real attention was paid because of the fact that there were fewer doctors, as well as the 2 that were up there were due to retire. We were not only, even then, a choice for the uninsured, but we were a healthy choice for everyone. And so we saw some rapid growth occur after we opened up Atlantic. From Atlantic, we went ahead and took the dive and started to recruit pediatricians. We opened the Children's Health Center in Nassauatix, which was primarily for pediatrics. Of course, in order to have enough pediatricians to do the call, we had to recruit additional ones. We're fortunate to bring on a wonderful couple, and they've been here since, the Riopels. For the longest time, we had one pediatrician on call 24/7, and that was very difficult.
I don't know how many deliveries were back then, but it's about 500 a year. And sometimes, that's an all-night thing. And so I don't know how they did it.
When we first came here, we were on call for a hospital that didn't really have pediatric providers, so we were the pediatric providers.
Back then, we really had the policy in our group where if we sent someone to the ER, we had to see them.
We had to go in and see
So
them.
we did not let them see the ER doc first and then call us if they need us. We saw every patient that went to the emergency room. If a pediatric patient needed blood drawn in the ER on the floor, didn't matter, we had to do it.
There was much more inpatient pediatrics than there is now. A lot of things have changed with medicine that way, which is good. But we really had to do a lot of things.
So they 10 deliveries and, of course, admitted back then and went to the ER. Did a lot back in those days. So from Children's Health Center, we realized that the community down in the Northampton area, Bayview, Eastville, Sheridan, really had a problem as well with not having enough physicians. And so that's where we started the Bayview Medical Center.
We saw children, we saw adults, we saw individuals from all backgrounds. We saw patients who had insurance and the patients who didn't have insurance. And so really a diverse group of individuals. I think our office was the only medical office south of the hospital for a little period of time.
Oral health was something that we've been wanting to do and decided to do two crazy things in 2002. We wrote for an expanded service and we wrote for oral health. 2 grants in 1 year. We had been practicing in the schools as it was, but we had never brought anything right into a medical center. And the very first day our first dentist started, we had problems with the facility and we had to close that part of the facility.
Rural Health had gone to the effort to take a portion of Franktown and put in 2 or maybe 3 operatories, but that portion of the building had to be shut down because of drainage issues. So that first day, I found out that my mission, should I choose to accept it, was to go to Bayview and see if we couldn't set up temporary operations at Bayview. To try and make the plumbing and the electrical match up with where we could put the chairs was a real feat. But we were up and running in about 2 weeks. And at the same time, we were able to expand our school-based program. And then we came back to Franktown when a new wing had been put on. And so the operation kept going.
He was able to start working while we had the building repaired and took advantage of that and also added a few additional chairs thanks to the Mission of Mercy project that was very generous and not only coming every year and pulling lots of teeth, but also donating chairs from VCU as well as Panorex X-ray. That whole dental unit at Franktown was equipped as a result of the MOM project.
At one time, people from as far as Only were coming to Bayview, but now people can come to Bayview from the south. People from the middle part of the county can go to Franktown, and in between that they can go to Only, and in between that they can go to Atlanta. So we sort of span the Eastern Shore.
In 2006, we realized we needed to do something with this facility, and so that's when the architectural charrettes happened to determine what would that building look like. So every department was represented, and we carved out time, and that's how that concentric design that we have now, that is our signature, came to fruition. It was The people who worked here, they were the ones that dreamed about what it would look like, and patients as well, as far as how long of a hallway do you want to walk down, what kind of a maze of hallways do you want to be in, which moved us right out of the rectangular formation to the concentric design we have now.
In 2009, we started the big capital campaign and construction on the Only Community Health Center. So that completed and opened in 2010.
When we built the Only, it was a model of the spinning wheel, as I say. The wheel goes round and around. But when we went to Atlantic, we did recognize the fact that we needed dentistry. So we added dentistry there. And then coming to Eastville, you know, we're going to do dentistry there too. But we had the pleasure of partnering again with one of our local pharmacists, Rayfields, and they'll be joining us. So that'll be the first time that we'll have pharmacy at that level on one of our properties. So again, that one-stop model is driving our strategic planning for Eastern Shore Health.
Eastville Community Health Center is the third building of its kind. This facility will house 10 medical providers, 3 dentists, dental hygienists, nurses, business assistants, right here on this property. What's amazing is that the vision of some Eastern Shore pioneers like Dr. Bell Fears, Mr. Robert Parks, they were the ones who formally pulled this together and got the first grant to be able to take care of people who otherwise go without health care. And over the years, we have become the provider of choice for approximately 37,000 people of the 45,000 people who live here.
Years ago, we used to do health fairs, but then we started offering all the services within our organization. Exactly. So there was no longer need. We have the dental in our offices now. So things that we had to have a one-day big affair and get all these people to come in and volunteer, we can offer it every day now. Every day. So that's kind of how we've grown over the years, and well, the sky's the limit. Right. So we just keep looking at new ways, how we can expand and how we can service the people in the community.
We're part of your community. We're your community health center.